my name is Maureen, and I'm a registered nurse with the Southern Alberta Adult Home Enteral Nutrition Program. This teaching session is for people who have a gastrostomy tube or a G-tube that means a tube that is going in your abdomen and the tip is in your stomach. Hi, I'm Maureen. I'm a registered nurse with the Southern Alberta Adult Home Enteral Nutrition Program. You'll often hear us called the Home Enteral Nutrition Program for short. We are a team made up of physicians, nurses, unit clerks, supply clerks, social worker, and registered dietitians. And our team is here to help you with your tube feeding, tube care, and providing you with all the supplies that you need to take care of that tube. The manual that you have received is called the Home Enteral Nutrition Patient Learning Manual. And in here on page 6, there are contact numbers. And these contact numbers, the first is for the Home Enteral Nutrition Program nurse. And we are available in the office Monday to Friday, 8 till 4. We don't accept calls after 2:30. So if you do call us after that time, you'll just get a voicemail. Please leave a message and we'll call you back as soon as we can. It may take 1 to 2 business days till we return your call. So if it is something that's more urgent, say your tube is blocked, you would call our pager. And to do that, the number's written in the book there, and you'll hear voice prompts. Once you phone that number, it will walk you through how to page us. When you page us, we ask that you wait 15 minutes before you expect a call back from us. The reason for that is if it's in the evening, we may be out driving somewhere and we'll need to pull over in a parking lot somewhere so we can safely phone you back. We also ask that after 15 minutes, if you don't hear from us, please page us again. It may be that the page didn't go through correctly. Sometimes we'll get where not all the digits of the phone number come through on our pager, and then we have no idea who called us. If you have trouble with the paging system, you can also call the hospital operator, and their number is in the book as well, and ask them to page us for you. When you are having concerns about how much formula to take, if you wonder, are you getting enough vitamins in that formula, questions like that, our dietitians are happy to help you with. Their phone number is in the book there as well. They're available Monday to Friday, 8 to 4. The clerk's number is in the book as well, because she is the person you're going to phone with supply orders. And she will also take messages to pass on to the nurses if you have a concern that is something that we would be able to help you with. If you are calling that number, even in the morning, you might still get our voicemail because our unit clerk might be on the other line. Just leave a message and we will call you back just as soon as we can. The last number that is on that contact numbers pages is for the community home care. And if you have been set up with home care, the general phone number is recorded there. Once a home care nurse comes to your house, he or she may give you an additional number to call. That's a more direct number to your case manager. Page 9 is titled Your Feeding Tube. And on this page is some important information. On this page it says the brand, size, and type of tube that you have, when it got put in, who put it in, where it was put in, and there's also measurements recorded on there to say, for instance, if you have a NG tube, so that tube in your nose, it will say how many centimeters that tube is at the nostril. It might say at the chin, or like on this model, there's a Sharpie mark put on here so that you could see if it's at the same spot on her ear. And if your tube doesn't have a mark and you find it hard reading the little numbers that are recorded, just take a Sharpie and just color on there And then that way it makes it easier for you to know that your tube hasn't moved. The other thing that is written on this paper is when your tube is due for an exchange. So most abdominal tubes are exchanged every 3 months. Some are 5 months, some are 1 year. NG tubes, the ones in your nose, we will be checking on them monthly. And they shouldn't stay in longer than 3 months. So that kind of information is there. If we're on call, we won't have your chart, and we will ask you to read to us some of that information. That will be very helpful. If your paper has not been written in, so it's blank, when we phone you after you've watched this video and you've been discharged home, we will help you to fill that in. Okay, going on, the next page, 11, talks about hand hygiene. And I'm sure all of you have heard a lot about hand hygiene. So that just is the fancy name for washing your hands. And hand washing is the most important thing that you can do to prevent infection. So anytime you're going to do anything with your tube, before you start, we want you to wash your hands. Now, if you use soap and water, you want to do that for 20 seconds is the scrubbing portion of that. Then if you don't have anything visibly showing on your hands that's dirty, you can also use hand sanitizer. And the hand sanitizer will do the same thing to cleanse your hands. The procedure to do tube feeding does not require gloves. It's not a sterile procedure. It's just clean. If you think about how you work in your kitchen, cooking food, you don't need to wear gloves at home when you're preparing food for your family or yourself. This is the same. It's just you're putting the food through a tube instead. So we just need your hands to be clean. So on page 13, you'll see it says your feeding formula. The formula that you will be using will be written on a schedule, so you'll know exactly what formula and how much you're going to need to give yourself every day. The formula will either be in a can or in a tetra, like this. And the thing to check on either your can or your formula Tetra Pak is the expiry date, which is on the bottom of the can or on the bottom, or the top, sorry, of the Tetra Pak. Before you give yourself this can or Tetra, you're going to give it a really good shake like this, just to get everything mixed up well. When you are storing your formula, you want to keep it just someplace dry and cool. So you don't want it in the fridge, you don't want it left in your garage if it's winter, because it will get too cold. And so just if you can keep it inside, that would be great. The formula provides all the nutrition that you need, so you don't have to worry that, oh, I should take something extra. Your dietitian that's made the formula schedule for you has taken in consideration all that you need. The other thing to take note of with storing the formula is if you only use half of a can or half of a Tetra, you can put the remaining half in the fridge, just cover it with some plastic, and it can stay in the fridge for 48 hours. After that time though, you'll need to throw it out. If you are doing continuous feed with a pump, so it's over a long period of time, only put enough formula in the bag that can be used up within 12 hours. We don't want the formula to be opened at room temperature for more than 12 hours. So when you're preparing your feed, just like when you're preparing food in the kitchen, first thing you want to do is the hand hygiene. Washing your hands for that 20 seconds, and then clean the surface where you're going to prepare the food, so you're going to wipe off that counter or table. You can wipe off the top of the can or the carton, peel it open, and after you've given it a good shake. And those are the main things to remember. Check your expiry date, shake it well, and store it in the house. So now we'll go to giving medications through your feeding tube, which is on page 15. The next couple of pages are about giving medications through your feeding tube. So if you need to give your medications in this way, that's a resource you have to follow through those steps. If you don't remember what we talked about today, you can just follow along there. But the important things to remember are, one, never put your medication into your feeding bag with your formula. If you were unable to finish your tube feed, that medication is still in that bag, but we don't know how much of it is there and how much you've gotten. It also might interact with the formula in the bag and block the tubing. So we would recommend you always give your medications in the tube, or if you can take them orally, that's fine too. But for those of you who need to give them in the tube, we also ask that you remind your physician, if they're giving you a new prescription, that you're putting it in a feeding tube. Some medications are not meant to be put in feeding tubes because they block them. So you really want to watch what kind of medications you're getting, and remind the physician or the pharmacist when you're filling that prescription that is going in a feeding tube. Some of the medications come in liquid form, and then that makes it easy. You would just need to drop the number of milliliters of medication and dilute it with 2 to 3 times the amount of water. And that way it will go through your tube and not block your tube. The other thing to remember is never put all your medications together in one syringe. They might be okay mixed together in your stomach, but when you mix those in a syringe and then start putting that through your tube, they could interact with each other in that tube and form solids that could block your tube. So to avoid that, we want you to give medications one at a time, and always flush between each medication. Now, if you were going to have a pill that you needed to crush, how are you going to do that? Well, there's several options. One is to take 2 spoons and then just crush that pill between the spoons. 2, if you have a mortar and pestle at home, you can use that. Or 3, you can go down to the pharmacy and buy a pill crusher. The pill crushers work very well, and they cost around $4. I've seen them at pharmacies, so that might be a good option for you if you have to crush pills. When you crush the pill, the next thing you're going to do is you're going to pour that pill into a little bowl, a little shot glass, something, and then what you'll do is you'll pour water into the bowl with the pill powder. Then you can take your syringe and stir that powder up in the water until it's all dissolved, and then you can draw that up into your syringe. Then what you'll want to do is take a big syringe and you're going to draw up 50 milliliters of water. When you attach this to your tube, you're going to use a push-pause method. Push, pause, push, stop, like that. That is to help clean out your tube and make sure it's all working well. You'll do that before you give the medication. So you do that once, then you would give your medication. We'll just pretend that I'm putting that back into a tube. After that, I'm going to drop another 50 milliliters. And again, I will give this through the tube, push stop, push stop, push stop, to make sure all that medication is well rinsed out of the tube. And then we can go on to the next medication or back to your tube feed, whatever it is that you wanted to do next. If you have to give yourself several medications, you'll notice on page 17, 16 and 17, it talks about giving only a 30 milliliter flush before you give the medication, and that's fine. Then give your medication, then you can flush your tube with just 10 to 20 milliliters of water to make sure that tube is clear. Give the next medication, then another 10 to 20 milliliters of water to clear the tube, the next medication, and then just at the last flush of water, go back to using that whole 50 milliliters of water, that whole syringe, to make sure everything's flushed out well. Page 19 is titled Cleaning Your Tube Feeding Equipment. And this is an important step in order to keep you feeling well, keeping all your dishes clean. So that's how you need to look at your tube feeding supplies, that after each use you're going to wash them. So the one thing that you have to wash is your tube feeding set. So to clean this bag after your tube feed, there'll be some tubing formula in the tubing and adhering a bit to the bag, but you're done. So you've disconnected, you flushed your tube right away, now you clean. To clean, we just recommend any dishwashing soap, and you just put 1 drop right into the bag, and then some warm water. And close the bag up. And then, if you just shake it around, you'll get to make some suds in there. It will clean. Then take the cover off the end of your tubing, and you would open the clamp, the roller clamp, and then let all that soapy water flow right through to the end of the tubing, coming out into your sink. After you've done that, then you could probably run, only half of this through. Then you could fill it up with fresh, clean water. And shake it, pour it out. Shake it, pour it out, until you have no more suds showing up. That might take 3 or 4 times that you're doing this. Then you want to run that clear water through your tubing until all that's coming out at the other end is nice, clean water. You don't want to see any bubbles anywhere in the tubing. If you don't rinse those bubbles out, what could happen is it could give you diarrhea. So we want to avoid that. So make sure you rinse well. The other part to clean is your syringes. Now the syringes can be taken apart, just pulled out, and you can wash these in your sink with dish soap and warm water. Do not put any of your equipment into the dishwasher, but rather just wash it with warm soapy water, rinse it well. When you have washed all your syringes and they're laying there separate, take a moment to push that plunger into your syringe and then let it sit like this. If you let it totally dry, separately, so just like this black rubber can expand, and then you won't be able to get them back together again. So put that like so, and then it will be good for your next use. We want you to take out a new syringe and a new feed set every 5 to 7 days if it's a gravity bag, and you can take a new feed set a little more often if you are doing pump feeds. And in our pump feed section, we'll go into that in more detail. But for gravity feed bags and syringes, a new syringe can be used every 5 to 7 days. Or if you want to keep using, if you just are using one for water flushes and it's still working well, you can use it longer if you choose to, but we will supply you with enough so you can take a new one out every week. Page 21 is called mouth care. And mouth care is important whether you are eating food or only tube feeding. There's bacteria that can build up in your mouth that can cause cavities on your teeth or sores in your mouth. So always remember to regularly brush your teeth, floss your teeth, and take care of that, even though no food's going in through your mouth. On page 23, it talks about monitoring and follow-up. So what that means is that the one thing we want you to especially monitor is your weight. We would like you to weigh yourself once a week, and if you could weigh yourself at the same time of day, wearing about the same clothes, on the same scale once a week, and record that, then we can have an idea of how you're doing with your weight. Once a week is enough. We don't need a daily weight. But if you notice that you were gaining more than 2 pounds a week for a couple weeks, or losing that much, you want to give us a phone call so we can see if we need to adjust anything in your feeding regime. Then the other thing in your book, there are pages at the back that say date, and there's a place to record your weight. So if you want to use that, if you want to put it in your phone, if you want to write it in a calendar, wherever works for you. And then that way when we're having phone conversations, you can give us the actual numbers so that we know where you stand. And that is part of the follow-up. We won't be calling you on a regular basis. Rather, we're expecting you to give us a phone call if you're having any problems. Once a year, we'll have you come to our clinic for an annual review. We'll check your site, we'll talk about your feeding regime, our dietitian will meet with you. Otherwise, it's basically kind of as needed. So if you had, if you were having some problems with the skin around your site, we could have a clinic appointment, you could come see us. If you need your tube exchanged, the initial tube exchange we will do in our clinic. After that, it may be that we've taught one of your family members to change the tube, or perhaps home care is doing that tube exchange. So we won't necessarily have to see you for that either. But we certainly want to hear from you if you have any problems with the tube or tube feeding. And if you leave us a message, we'll always be sure to give you a call back. Our goal is always within 1 to 2 business days. Now we're going to talk about how to care for your abdominal feeding tube. So my little model here would show this way if you were laying flat, but then you won't be able to see. So I'm just going to tip my little model over on its side. And what we're going to do is go through what you would do to clean your site every day in order to keep your skin healthy. So there's a lot of things here on the table that will help. So over here we have some Q-tips. You'll have those in your supplies to clean around the site. You'll have adhesive remover swabs, You'll have barrier wipes that will help protect your skin from where the tape is going onto the skin. A flexi track is here, and a flexi track is what secures the tube. If your tube is just dangling like this, that will rub on your tube site and it can cause hypergranulation tissue. So we would, it's a little hard on this model, but we'll say this was your abdomen still here. This is where the flexi track would go to hold that tube in place and minimize the movement of the tube. So that is, oh, and also this is a type of gauze dressing that has a split in it. It's called a drain sponge, and it's so that you can easily put the dressing onto the tube site. If you don't have a lot of drainage at your site, you might want to cut down that instead of having such a big dressing. Initially, for the first 30 days, go ahead and use the whole dressing and use this pink little vials of normal saline. This will be used to cleanse the skin every day. After a month, though, you can use Sprome, which is in a spray bottle, and I'll show that to you in a moment. And the other thing you can use is just plain soap and water. Whatever you're washing your body with, you can use to wash that site after 30 days. If your skin has gotten irritated, there's open areas, you're going to go back to using this normal saline. But if the skin is healthy, and after 30 days, soap and water or Sprome. Yeah. Let's say we've just taken off the dressing from your tube site. If there was some tape residue, we would use the adhesive remover, and you would just rip that package open. It looks like an alcohol swab, and you would just rub it on the place wherever the tape residue was. Okay, then you would take one of these vials, and in your supplies you'll have either 2x2s or 4x4s. That's just called because of the size of the gauze that are in. They could be just in a big package because they don't have to be sterile. So you won't necessarily see individually wrapped ones. Okay, and then all you do after you've twisted that cap off is it's like spraying. By pushing, it sprays out the normal saline, and what you're going to do is on your tube, I just have to get my model untaped a little here from the inside. You're going to take your tube and you're going to clean right at the base and go around, all the way around, and then you're going to throw that into the garbage. And you can take another one, wet it with the saline, and go again. Moving that tube, going around. If you don't have as much space to go under, and you feel like there's something there that you want to, there's maybe some dried on something, you can spray that right onto the little Q-tip and give it a rub wherever that is that it wouldn't come off. And then, again, throw that in the garbage. So now our site is all washed off. We can take another gauze and we can dry that area. And then we'll take our drain sponge and we're going to put that underneath so that if you can see the split there, and is toward the top of the split. Okay, Then this model, it's not cooperating real well. It's not attached like it is to you. Okay, so there we go. We've got the gauze in place. Now, some people find they don't even want to use much tape, but there are several options of tape. There's this, it comes in a roll, you just cut off however much you like. When you pull it, you don't see it there, but when you pull it, it has a little split in it, so that makes it easy to get the backing off. And then what you can do is tape over the top of the gauze and then on your skin. And just peeling that off. Taping that down. Now, you can also use the barrier wipe to go on the skin and just wipe, let it dry for 30 seconds before you put the tape on. This just provides a barrier to protect your skin. So rather than this tape being directly on your skin, it's actually going on this thin film, and it will help your skin from becoming irritated. So some people like to use this tape called MeFix or Hypafix. Some people will use this tape, and it's transport tape. It's just kind of clear tape. We can also supply you with paper tape if you find these irritate your skin too much. So there's several options. All of them do the same trick in holding that dressing in place. Then you'll have the Flexi Track. And this is just in a little package here. It has some blue tabs. And this, if you pull that off, then this area that is not blue is what is sticky. And we can just put it together. So then these blue tabs are what you can grasp, they're not sticky, to open and close. The back of this has a cover, and when that's peeled away, this side is sticky. Wherever you're going to put the Flexi Track, you want to have put some of this on the skin. So we'll just put it on the side of this model for now. And what this does is it holds that tube in place, as I mentioned. And when you're going to use it, you just lay your tube in the space and then clip it shut. This way, when you go to do a flush or a feed, all you need to do is open the tabs, close it up, and now you've got access to your tube to do a flush, give medications, or do a tube feed. When you're done, again, open it up and lay it in there. This will decrease the irritation because you won't have to be pulling the tape off your skin every time. So it's a good thing to use to protect your skin and keep your skin healthy. Now, when you put it on, this is obviously not someone's abdomen, and when the tube is taped straight out beside you, we would want to make sure that there was enough give there that the tube wasn't pulling. We wouldn't want the bumper to be like this. That would mean that it was too tight. The Flexi Track was too far away, or the tube was pulled too far, because you can see if I pull on here, you see how I can do that? I didn't move the place of the tract, but I moved what part of the tube was sitting in it. Okay, so we want the bumper to be within a dime's width of the dressing. So it should be snug and attached to your abdomen. You're going to do this dressing change once a day. And if the dressing becomes wet, maybe you go to do a feed and somehow you manage to have some leakage when you're attaching or detaching things, or if there's just some draining, a little draining out and the dressing gets wet, you might need to change the dressing again, because we want to keep that site always clean and dry. We have our formula, we have our water, we have our feeding set here, and we also have a hook. And you can choose to use this 3M hook that is in your supplies, or if you have a coat stand that you want to use or something else, if you have a pole at home or a light fixture that has a hook on it, you can feel free to use that. If you're not familiar with the 3M hooks, they come with these little tabs. And what you do is, you look how it's going to be up on the wall. The red side, you're going to peel off the backing and stick it right to the back of the hook. And then you peel off this side with the black writing that says toward the wall, and you just stick it up on your wall. And then that is your place to hang every time when you do your feeds. You may want to even purchase another hook and hang one in your kitchen, so when you are washing your bag, you have a place to hang it to let it dry. So for the next steps, what we're going to do here, when I'm preparing everything, like I said, we've washed our hands, gathered our supplies. Now we've taken the feed set out of the bag and closed that clamp, so I'm all ready to fill my bag. On my schedule, we'll just say it says I need to use 1 tetra of IsoSource Fiber 1.5 and 150 milliliters of water, so that's what's in my bag. When I take my formula, I'm going to give it a good shake, and I'm also going to look at that expiry date, making sure it's not expired. If that's all good and I've given it a good shake, then I can peel off the silver tab And then what I'm going to do is I'm going to take the feeding bag and just pour that right in. And sometimes you can give it a little squeeze to get the last little bit, and then you're done. You can take that, put that in your recycling, take it to the bottle depot. Then I'm taking my water, pouring that into the bag as well. And then I'm going to close the bag. And if you see here, this little part just tucks in. And I find if I put my thumbs in the middle and push straight down, it will seal well. And then you can just put that little tab through the little side thing there. So now you can see my water already mixed with the formula, so I don't really have to do anything else. Now I will take the chamber, this is called the drip chamber, and I'm going to give it a squeeze. And as you can see, when I squeezed it, the water, or the formula and water, came up. I'm going to give it one more. You want to be able to still see the drip, so you don't want to completely fill that chamber. And now what I'm going to do is I'm just going to set this down so I can take the cover off. the end of the tubing, and I'm just using this jar so I don't get a mess here on my table. If you were preparing it at home, you could just hold the formula tubing tip over your sink. So now I'm just going to open the clamp, and you'll see that the formula is coming down the tubing. And when that formula gets to the end, I'm just going to shut that off. Now I could just hang the formula bag up on my hook until I'm ready to start. So what do I need to do to get ready to actually start that feed is what we've discussed before, is checking the position of your tube. Is it in the right place? So if you have an NG tube, a tube that goes in your nose, and the tip is in your stomach, you're going to be looking, well, did my Sharpie mark still stay at the tip of my ear? And if it's there, then you know that the tube hasn't come out. If this loop and tape is all looking the same, then it should be good. For an abdominal tube, we have this little setup here to mimic a G tube. And in order to check if this tube is in the correct place, you can look on the tubing itself. There's some blue writing on this tube. It will have a centimeter mark. Here it says 4 at the top of this round part we call the bumper. And there's a little 4 there. So if it's always at 4, you know that the tube is in the correct place. You're looking, is it longer than normal outside my body? If you don't see a marking. And so to snug up your tube, you're going to gently pull on the tube. And then when you feel light resistance, you would just slide the bumper down. So now it would be a dime's width from your skin or from your dressing. So we'll say this tube is in the correct spot for this person. And before we do a tube feed, we always need to do a flush. And the amount of flush is going to be written on your feeding schedule. So we're going to say that we need 1 syringe for this person. So we would draw up out of our water jug 50 milliliters of water. Then we would clamp the tube. I should move this so you can see. There, we clamp the tube and we go and we open the port. If we don't clamp the tube and we open the port, you could have stomach contents leaking, so that wouldn't be good. So clamp your tube first. Then once your syringe is attached, you can unclamp. And now you're going to flush using the push stop method. Okay, then clamp again. Disconnect your syringe with a twist. And then you're going to take that tube feeding and push that in. It doesn't need to go all the way like that whole white part. It's just in till it's firm. And now you would take the clamp off. If your bag is hung at appropriate height, then now you just open this roller clamp by pushing it up, and then your formula will go into you. You can adjust the rate of that formula by going faster, to go faster or slower, just by rolling it up and down. Then when your tube feed is complete, you will just take the clamp again, and this time try to clamp on, just a little different spot on the tube, so you don't wear out the same spot every time. And now when it's clamped, I'll hold it up and I'll twist that feeding tubing out, and I'll hold this up until I close the port, and now I will take the clamp off. And what I will do or I could leave the clamp on even, because now I need to flush again after the feed. So I've pulled up another 50 mils of water, pretend, opened the clamp, attached the tube, syringe to the tube, and now I'm taking off my clamp. Push stop, push stop, push stop, push stop, push stop. All that water goes in. Reclamp the tube. Take off the syringe with a twist. And then close that port. And remove the clamp. And we're all done. When you do the tube feeding with the nasogastric tube, the only difference is you're using this syringe with the blue tip, because that is what would fit better. And for many people, they just like to fold over the tube. And if we had drawn up water, which I can't actually put water into our poor Miss Mannequin here, but we can just open a port and stick the syringe in, push pause, push pause, push pause. Sorry, I popped open another one there by accident. And then when that is all, when you've pushed all that fluid in, then I would clamp again, pinch the tube or clamp it, close the port. Whoops, my syringe came right off. And that happens, the little blue tip, if you're not got it twisted on tight enough. We'll remove that and close the port so that nothing leaks out, and then we let go. Okay, so to review, pinch when you're opening and closing the port, or removing or connecting your syringe. And then when everything's shut, you're good to go until your next feed. So in page 25 of your manual, it says dealing with tube feeding problems. There's a whole list of problems that might occur. So down the road, if something's not going right and you're wondering how do I fix this or deal with this, you can always go to page 25 and look on the list and see if what's happening for you is there, and then you can go to the appropriate page and figure out what you can try to solve the problem. So now what I want to do is go through each of the complications or problems that might happen, talk about how to prevent it and what to do if it actually did occur. So the first problem there is on page 26 is a blocked feeding tube. If your tube is blocked, one of the most common problems is that you just forgot to take the clamp off the tube. So check that. The next thing is that to prevent your tube from getting blocked, you always want to flush before and after your medications, feeds, and you always want to flush using the push stop method or push pause method. So if we were to fill up our syringe and just pushed it in lightly, it's not causing much turbulence, but push stop method will help to clear that tube. If you had a situation where you used your large 50 ml syringe and it didn't clear the problem, you could then try the 20 milliliter syringe to clear the tube. Again, using that same push stop. And try pulling back as well. So when you go to push and nothing happens, then pull back and forth. That kind of a plunging motion might be just what's needed to clear the tube. If you've tried that with the 50 and the 20 and now you're with the 10 milliliter syringe, you're going to do that same thing. Lukewarm water, pull back and forth and see if you can clear it. If you are unable to clear the tube after you've tried all that, please give us a call and we'll direct you further. Now, to prevent this from happening, like I said, you need to always flush your tube, use that push pause method, And always flush your tube even once a day if you're not even tube feeding. Just that will prevent it as well from getting blocked. The next problem that might occur is a dislodged feeding tube. So the whole tube just comes out. Maybe you'll just wake up and, oh my goodness, my tube is laying beside me. Or you help your friend, mom, dad to the bed, and as you're moving them, maybe by accident, that tube gets hooked onto something. If that happens and that tube is pulled out, you have an emergency tube replacement kit. This kit will have in it a tube that is the right size for you. You'll have one that is exactly the size that you have and one that is slightly smaller. So for instance, this emergency kit has a number 14 size tube, and you can see it says 14 FR. So that's for 14 French, that's the size. The other tube that's in the bag is a 12 French. So what you want to do first is use the tube that's the same size. So if you have a 14, you're using a 14. The instructions on how to replace the tube are written in your manual. They are also written right on the sticker. And I'll just read to you what the very first step is. It says, if your G-tube falls out, number 1, don't panic. I know that's the thing that you want to do, but take a deep breath, let it out, and then follow your instructions. So the first thing you're going to do is you're going to take the tube out, and you'll see it's this long tube, but everything you need for the next steps are all in your bag. So the first thing you're going to do, like I said, is take this tube out of the package, and you're going to lay down flat, and you or whoever you got there helping you is going to put that tube in. And all they're going to do is take the tube and put some of the lubricant. It's in this little package. They're going to put some of that on the tip of it, and when you're laying flat, they'll just push that tube right in. And they will push it in until that bumper, remember the round part is what we call the bumper, till that bumper is right against your skin. And then just tape the tube to your abdomen and give us a phone call, and we'll instruct you what to do next. If when you go to put that 14 in, you push really hard and it just won't go, you do need to push with some force, but you've tried and it's just not going in, then you would take the 12 French tube. That means this tube is just a little bit slimmer, and you're going to use that tube and do the same thing. Put some lubricant on the end, push it in all the way to the bumper, tape it to their abdomen, and give us a phone call, and we'll help you with what's next. Okay, so that's the dislodged tube. Now we turn to page 28. 28 talks about a broken or cracked tube. Whenever you're using a clamp on your tube, we want you to use this blue clamp. In the hospital, there are some green clamps. They have teeth on them that could damage your tube. So always be sure you only use the blue clamp. You also want to protect your tube from pets or sharp things. We've had people who have had a dog jump up and get a hold of their tube because it was dangling and they thought it was something for them to play with. So be really careful, keep your tube away from pets. And you want to keep scissors away from there as well. We've had people who are doing crafts reached over to grab their clamp and instead picked up their scissor and actually cut their tube. It has happened. We don't want it to happen to you. So no sharp things around your tube. If though somehow even though you've tried your best to not have anything happen, maybe your tube's just somehow got worn out, there's a crack in it, somehow it's broken, you're just going to take your clamp and clamp your tube so that the place it's cracked is here, then here's the clamp, and then your body. So if you clamp it between your body and before that spot that's leaking, it'll stop the leaking. Then you give us a call and we'll let you know what steps to take next. On page 29, it talks about abdominal feeding tube site problems. Now, at your site, you could get red skin, it could be sore, you could get blisters, bleeding, pain, you could get hypergranulation tissue. And hypergranulation tissue looks all red and puffy. Sometimes it's called proud skin because it's all puffed up. Now, if any of those things happen, you need to give us a call. We can instruct you what you can do to deal with it, but better off to prevent it from happening in the first place. So what you need to do is when you have your tube, and we'll look at our little model again, you want to make sure that you're using the flexi track to hold the tube in place so it's not going in and out. That will help prevent hypergranulation tissue. Also, keeping that bumper snug down so you could only fit a dime between the bumper and the dressing will keep that tube again from moving. Another thing to help your skin stay healthy is making sure that your dressing is always nice and dry. So if you change and clean that site well, dry it and put a new dressing on once a day, that's great. If it gets wet, you're going to need to change it again to keep the skin healthy. The next thing that you see as far as a problem is on page 31, which is leaking around an abdominal tube. The leaking can happen if that bumper is not snug up. If that bumper is like this and the tube is hanging down, you will have leakage from your stomach. So you want to always keep it snug. To do that, what you need to do is gently pull your tube until you feel a slight resistance. Then you just slide that bumper down, so then now it's snug. Okay, that's one thing that can help with leakage. Another thing that could happen is that the tube is in the right place, but you're having constipation. And because of that, it's making more pressure in your abdomen. That formula you're putting in has nowhere to go, and so it's going to start coming out around your tube. To prevent that, you want to make sure that you're taking any motility or laxatives that the doctor has ordered. And if you have problems with that, you want to give us a call. We can also advise you. If you're feeding too fast, you might also end up with the problem of leakage. Okay. So now the next problem that's talked about is on page 32, nausea and vomiting. If you get nauseated while you're doing a tube feed, you might want to slow it down. So that means adjusting your roller clamp or decreasing the rate on your pump. When you're tube feeding as well, to help with this is make sure that you're either sitting up, or if you're sitting in a recliner, just make sure it's only it's not going flat. You're at least 30 degrees. And for 1 hour after your tube feed, be sure you do not lay flat. Make sure that you're taking any motility agents, again, laxatives, that's going to help prevent the nausea and vomiting. Make sure that you always are doing hand hygiene before you're touching your tube and preparing tube feeds or medications. Make sure that right after your tube feed is finished, you immediately go and wash that tube feed set out. Don't let it sit around and just wash it when it's the next tube feed time. Also watch that you don't use expired formula. Make sure you check the dates. Don't keep formula in the fridge and opened can for more than 48 hours. That could also cause you nausea and diarrhea. Then, if you end up with nausea and vomiting, and so you start vomiting while you're tube feeding, please stop your feed. Give yourself a little rest. If you have anti-nausea medications, you might want to take something before you retry to do that feed. You might also just have the flu. So you'll have to just evaluate things, and if you need help to figure that out, you can certainly give us a phone call. The page 33 talks about diarrhea. We define that as more than 3 loose or watery stools in a day for more than 2 days. So if that happens to you, again, you might have the flu, or it might be a problem with your tube feeding. So many of the prevention things are the same as for nausea and vomiting, and those would be including hand hygiene, making sure you prepare your food on a clean surface, make sure your formula hasn't expired. All of the things are listed in your book, like I said, that's so you can review if you came up with a situation with diarrhea. If you did end up having diarrhea, you could also be asking yourself, okay, so are other people sick in my house? Is it likely that it's from something that's going around? You could decrease the rate. That might help. And if that diarrhea continues, please give us a call. We can advise you what to try next. Constipation can also be a problem. That's on page 34. Now, normally, when people are on tube feeds, their bowel movements are often like toothpaste consistency. But sometimes you can still get constipated, and if that happens, it may be that you need more water. Maybe you're just not getting enough fluid. So let us know. We can advise you, and our dietitian maybe will adjust your regime, how much fluid you're supposed to take each day, or we may need you to see your doctor to get a prescription for something else. On page 35, it talks about dumping syndrome. This syndrome can happen if your tube is not in the right place. So if your tube has accidentally now gone too far in, so that instead of the tip of it being in your stomach, it's now in your small bowel, you could get dumping syndrome. If you think about your stomach is like a bowl and all this formula goes in, and that bowl can hold it. But your bowel is much smaller and it can't tolerate all this formula so fast. So dumping syndrome will occur when the speed of the feed is too fast. The symptoms of that are listed in your book: diarrhea, flushing, sweating, weakness. You feel really full, you feel faint, you might have heart palpitations. The feeding tube looks shorter than normal. So that's why it's always important to prevent this, is to check how long is the feeding tube. Is it out of my body the same way as it normally is, or has it traveled in? If you have those symptoms, you should give us a call. We can help you to figure out what to do next. We might need to have you adjust that tube. The other thing is, if you feel this way, you can decrease the rate of your tube feed on your pump or on your roller clamp. But if truly that tube tip is into your small bowel and it's supposed to be in your stomach, you're going to need some help to adjust that tube. Dehydration is something else that can occur, and if it's hot weather, you might need to give yourself more water flush, just because if you're sweating a lot. Signs of dehydration include being really thirsty or your mouth's dry, and one of the best ways to see is if you're dehydrated is just looking at your urine. When you go pee, is it really a dark concentrated color? If it is, you need more water. It should be quite pale or almost clear. And if you need guidance with how much water to take in, you can give us a call and we'll be happy to help you with that. Okay, the last complication is aspiration pneumonia. And that's just when the fluid that's going into your stomach is backed up and is entered into your lungs. So that's why it's so important to feed sitting up or at a 30-degree angle, never flat, and always remain flat for 1 hour after your tube feed is finished. And if you feel really full and you just kind of don't want any more, just stop your feed. For whatever reason that day, just stop it. If this is an ongoing problem and you're not able to take in the amount the dietitian wrote on your schedule, give us a call. We'll talk through that. Signs of aspiration pneumonia, though, are heartburn, coughing, trouble breathing, chest pain, fever, and shortness of breath. If you have these symptoms and you have a high fever, these are things you're not going to just stay home and hope they go away. You need to give us a call. You're going to need to see your doctor or come into emergency. So on page 37 of your manual, it talks about equipment and supplies. So our program will supply you with everything that you need to tube feed and take care of your tube site. And what you need to do is just order those supplies. And what we ask you to do is look at how much you have of the different items that we supply before you call to order. We want you to count. How many syringes do I have? How many feed bags do I still have? So that you don't order things that you're not using. And then when you do want to order them, what you need to do is give our unit clerk a phone call, or you can fax us an order. If you phone in your order, then our unit clerk will tell you what date the supplies will be available for pickup or they will be delivered. If that date doesn't work for you, please tell the unit clerk. And, for instance, Tuesday you've got a doctor's appointment and she's saying Tuesday is the delivery day. Well, just ask for it for Wednesday and we'll do our best to accommodate you. If it's for pickup, you're going to pick it up in the McCaig Tower at the Foothills Hospital. And there is a large cart just inside the west entrance. And that entrance may not be available, so you would just have to go in the main entrance of the McCaig Tower. You go down this long hall. When you get to the admitting desk, just before that, and just before the fireplace, you're going to make a left turn. And you go down that hall, take your first left, and right there will be a cart. And on that cart are going to be cases of formula with your last name recorded on it, and there'll be a big paper bag with any dry supplies, so syringes and tubing and things like that will be in a paper bag. You can pick that up there, and there is a wheeled cart just to make it easier for you, so you can just move that in one trip to your car. And in front of the west entrance and the main entrance, there are some unloading loading zones. So you can just park there, come in, get your supplies, and load them into your car and take the cart back. And then you don't even have to pay for parking. When you're ordering supplies for delivery, just remember someone does need to be there to pick it up, because we can't leave it on your porch. Especially in winter, you can imagine the formula would freeze. Okay, so when you don't need to tube feed anymore, say this is a short-term thing for you, and now your doctor's removed your tube, what I want you to do is give us a phone call. when that's happened. And then you can return to us any unopened cases of formula. The ones that you've already opened and any of your syringes and gauze and all that, we can't have that back because of infection prevention policies, but we can take back the unopened cases of formula. So give us a phone call and we can arrange to get those back. Okay, so that concludes our teaching session for today, and we'll be in touch and talk more with you on the phone soon.